I'm Robyn Scatena. I'm sitting here in the pulmonary section at Norwalk Hospital, part of the Western Connecticut Health Network.
Okay.
I'm a pulmonologist and a critical care doctor. As a critical care doctor, I manage the intensive care unit here at Norwalk Hospital, and I care for patients and the family members of patients who are critically ill. As a pulmonologist, I see people with lung problems, and I particularly focus caring for people who have lung cancer or concern for lung cancer. So Western Connecticut Health Network is a partnership between Danbury Hospital, Norwalk Hospital, and New Milford Hospital. And by pooling our resources, we've really brought together the most exciting technologies and the best practitioners in the area that concerns me the most for managing lung cancer. So we have particular procedures that we can do here at Norwalk Hospital, such as robotic surgery with the Da Vinci machine. We have endobronchial ultrasound at both locations, and actually at Danbury Hospital they perform different diagnostic procedures like electromagnetic navigation to do non-invasive biopsies of lung nodules that could be cancer. In the lung cancer world, technology is key. I particularly perform a procedure called endobronchial ultrasound. So we go through a patient's mouth into their lungs using ultrasound to take a biopsy of their lymph nodes. They can go home a few hours after the procedure. We usually have results about their tumor, if it is a cancer, what kind of cancer it is. And the really exciting thing about that is oftentimes we're able to find genetic abnormalities in the cancer that make them candidates for specialized therapies.
So I just finished the last run about the cancer patient serum.
We at the Western Connecticut Health Network are partnering with different pharmaceutical companies to give our patients access to drug trials, so drugs that aren't yet even on market to treat lung cancers with specific genetic abnormalities. Having access to these drugs and to the tests to determine which drugs could be most useful to our patients means that we can treat them in the most effective way possible and also minimize side effects from traditional chemotherapies that would kind of blast away the good and the bad. I feel really lucky to be able to tell my patients that this is what you have, it's cancer, we know it's bad, but we know exactly what's wrong with these cells and we know how to treat it. Practicing medicine these days has given us access to technology that we hadn't known in years prior. The Da Vinci machine is a robot that can help thoracic surgeons perform lung cancer surgery to remove things that are suspected lung cancer. So the thoracic surgeon sits aside and controls the movements of the robot, and these movements are really tiny, and so this surgery is minimally invasive in a way that was really never possible before. And what it means for our patients is that literally 3 to 5 days they can be at home cooking, like a week or two they can be playing tennis like they used to be, and it's totally unheard of for our patients to have done that in the past. For both Norwalk Hospital and for Danbury Hospital, our communities have been really important to us. Our communities have invested hugely into our hospitals, and we see it as our mission to serve our communities. I think that was one of the important things that drew me here to the network, is really walking into work each day and feeling like I'm surrounded by volunteers and colleagues and patients and their family members who really are my people. Actually, I was reflecting recently on how I've found my home in critical care and in the lung cancer world, and I think the thing that drew me to both of these patient practice arenas was being able to work with a multidisciplinary team. In the intensive care unit, we work with nurses, respiratory therapists, physical therapists, residents, all working together to support the patient and the family through their critical illness. And in the lung cancer world, we work with social workers, nutritionists, and also doctors from all different sorts of fields. So I think the most beautiful thing that's come from the creation of the Western Connecticut Health Network is that we've put ourselves together as independent hospitals, we've pooled our resources, and we've committed to really being around for the long haul for our communities. I think now is a really hard time for individual hospitals to continue to provide the services to the communities that they'd like to. And I think in combining our strengths and banding together, we really will continue to serve our communities the way that we committed to at the beginning of our creation as hospitals.